Alison Baum is going to be speaking to us now about embracing evidence, innovation and collaboration to reduce inequalities and improve outcomes. Alison is the CEO and the founder of Best Beginnings. She is an Oxford University Science graduate with a background at the BBC, where she worked on programmes including Horizon and Tomorrow's World, communicating key scientific and medical breakthroughs. She has used her leadership and executive production experience to pioneer the development of innovative resources, including DVDs, art, and mobile apps to support the emotional and physical transition to parenthood. Before launching Best Beginnings, Alison set up an internet-based social enterprise called Express Yourself Mums, providing information and products for new mothers. In 2006, she founded Best Beginnings and wasted no time. Within just 4 weeks, the charity formed and led a coalition of more than 35 organisations, including 5 Royal Colleges and UNICEF, to lobby for the implementation of the Breastfeeding Manifesto. A year later, Alison won the Sheila McKechnie Foundation Award for Health and Social Campaigner of the Year. In 2014, Alison was awarded the CPHVA Campaigner of the Year and Woman of Democracy. In January 2017, she was awarded an OBE for services to tackling child health inequalities. All very well deserved, Alison. It's wonderful to have you here. And please share your screen whenever you're ready.
Thank you. It's really lovely to be here. I feel very, very honoured coming after Leah. I've always loved midwives before I even had my own journey with the births of my sons, and I really did think that last that section that Leah read was so powerful, and I will definitely be going and ordering the book on Amazon. Yeah, and it's interesting. Life is a journey, and we're all in the midst of our own COVID experiences as we are sitting or standing wherever we are in the world. I just packaged my son back off to medical school in Edinburgh, and I've just found out that Leah's I don't know whether it's her youngest or oldest is studying at the same place. So life is a journey. It takes us in all sorts of places, and it was my own challenges with my own boys, who are now teenagers, that led me to set up the charity. And some of you will have heard me speak before, and none of you will have heard me speak about most of what I'm talking about, because I'm going to be sharing with you a sneak preview of a brand new version of Baby Buddy that is launching just in a few months. I'm going to be inviting you to become beta testers, and I'm going to be sharing with you different insights that we've gathered in what was the most challenging of years. I think what last year did for me and for the Best Beginnings team is just highlight the need for what we're doing in terms of the need to empower and inform parents of all backgrounds, the need to support multidisciplinary professionals and work collaboratively with them, especially midwives. I'm going to give you a brief overview of Best Beginnings as a charity, because many of you know us, but maybe not all of you. And then I'm going to share with you some insights we, as a charity and in collaboration with many other charities, have garnered during the pandemic. Then give you a sneaky preview of Baby Buddy, and then I'm going to end with a couple of uplifting bits, including a song that was gifted to Best Beginnings by Jacqueline Dunkley Bent, a wonderful Chief Midwifery Officer, who is speaking, I think, very soon after my talk ends. So we work to reduce inequalities and give every child the best start, and that's through directly empowering parents, but also working really closely with the professionals who support them, with this really unwavering focus on reducing inequalities. And as I go through my talk, I've never done this before, it may be a good idea, it might be an ugly eyesore, I'm putting up links for more information, and anyway, these slides are going to be shared by the team afterwards. So I encourage you to read our annual report to get a deeper dive into our work and our plans. This is an infographic from our annual report, and what it endeavours to do in one page is I guess, show some of the stark inequalities that do exist. It's simply not acceptable. For example, that a Black woman in the UK is 5 times more likely to die during her pregnancy than a white mother, for example. So it's about working together to shift things. And our work is actually from preconception to the 5th birthday, but everything I'm going to focus on in this talk is in really the conception through to the 1st birthday, with these guiding principles that have been there from the beginning, underpinning everything that we do, working innovatively, vitally from the evidence, and I'd say utterly crucially working collaboratively, which is why I'm so excited to have the opportunity to tell you about Baby Buddy 2, which and invite you to be the first in the country to test it. Tiny bit of theoretical framework stuff. I think put the one slide in. Baby Buddy was explicitly developed for the whole pregnant population, but to be particularly relevant and useful for the families who experience the worst inequalities. So, and that Michael Marmot's review, which he published, the original one in 2010, gained more traction last year, necessarily through, because of everything that was happening with Black Lives Matter. And the new version of Baby Buddy that we developed all through last year and we're soon to launch was equally developed with this proportionate universalism approach. So some of you might know work that we've done, but may not clock that it comes from the charity Best Beginnings. So you may remember us for our Bump to Breastfeeding DVD or our Small Wonders DVDs, films, all of which are in Baby Buddy. And all of the content in Baby Buddy is moving into the new version, but with really significant step change improvements, including that there's going to be a digital personal care plan, pregnancy plan that parents can use the app for. But I guess I just wanted to spend a moment saying that what we do, let's focus on the Baby Buddy for a moment, it's not a magic wand. We are here as a charity to augment and amplify the phenomenal work that you as frontline workers are doing. I mean, what you've been doing this last year and onwards, birthing, supporting parents through pregnancy, the interpartum period and beyond. You know, it's exceptional, the commitment, the work despite serious challenges. And a lot of the feedback that's informed what we're about to launch has come from your feedback and the feedback of parents from across the country. So many of you will already be aware of Baby Buddy with its daily information and its 300 plus films. But I don't think many of you will know that this new version is about to come. So what I'm going to do is let you know that I'm going to come back to Baby Buddy 2.0, give you a taster of it and how it's going to be able to support you in the vital work that you do. And tell you how to get hold of it before anyone else does. But first, I'm going to share with you, this is the endorsing organisations of the first one, the daily information of the first one, reminding you all of this is here. But before I do that, I'm going to move forward and talk to you about what's been going on during the pandemic, because it's so front and center. So the slides I've just jumped over show that Baby Buddy was used significantly more by families. Actually, I will go back to that one. Sorry, was used significantly more by parents from Black minority and Black, Asian and minority ethnic groups. It was during the pandemic and subsequent to it, and that parents have found the app even, I have to apologize, this has never happened to me before. My husband is a doctor, he's gone into the hospital and the doorbell keeps going and my son is calling me to answer the front door. So for the first time, I think ever in a public presentation, domesticity has invaded and I lost my way. So I am back with you now, I'm sorry. I will come back to the new version of Baby Buddy, but it does build on all that the old version does, but with these significant new additions. So all the films that many of you know and love, whether it's Sheena Byron in there or Trudy, Senna Varatney, or young parents or parents across the country sharing their stories to support other parents on the journey, that will still be there. And in the new app, there will still be the 24/7 crisis text messenger. But it's worth those of you knowing right now, if you're not using it and the families you're supporting aren't using it, that this functionality is there on the App Store and usable, and that the app is particularly used and valued by families who are often underserved by services. So yeah, back to where I was before the doorbell incident. When the pandemic hit, very early on in it, one of our team members is actually a PhD student at UCL, and she instigated a survey within Baby Buddy, inviting Baby Buddy users to give us their feedback on the pandemic, their experiences of the pandemic, and also whether or not and how Baby Buddy, it was helping them. This is a link, if any of you want to write it down. I might have a colleague pasting that as we speak into the chat of the paper that was published at the end of last year by Alex, highlighting ways in which Baby Buddy was helping and also really useful insights. The survey was like a precursor to a bigger survey, which I'll come to in a moment. But first, I'm going to share with you little nuggets, quotes from the research that Alex undertook. And what you'll see that comes through, I won't read them out, but you can read them and read them later as well if you want, is even though it's only an app, I mean, actually, I will read the first one. Even though it's an app, it makes you feel you're getting some contact, some easily absorbed information that can be easily shared with my partner. So it's the idea that in the midst of a pandemic, when people are cut off from their normal support networks, it's even more of a digital best friend supporting them on their journey. And this is the usage level. What we found is that the level of usage was high, as it always is, and higher amongst those from Black, Asian and minority ethnic groups. And we looked at the level of usage during the 104 days of core lockdown. And on average, it was being used once a day or more by 85% of the parents. So it's just for you to be aware right now that this is a resource that can support parents right now through pregnancy until their baby is 6 months old, because the current app stops at 6 months old. The other thing that Best Beginnings did to gain insight was to join forces with two other charities, Home Start and the Parent Infant Foundation, and also with many other charities and brilliant midwives and others on social media who pushed it out. We did a survey for all pregnant and new parents across the country, and it led to a report called Babies in Lockdown. And I really do encourage you to read it. It doesn't always make for easy reading. There are some moments in it that are really challenging. This is the link to it there. What we unearth is some broad findings, which I'll come to, and also moments where you can just hear the words almost being written in the survey by the parents in terms of the difference that midwives or health visitors have made. So when the difference good care makes, and how it's been supporting them on their journey, but also real system failure in terms of lack of contact, a lot around that on the postnatal side. So I encourage you to go and have a deep dive into the report yourself. And share it with your colleagues, because it does surface some really challenging pieces, whether you're talking about birth trauma or difficulties feeding, lots around loneliness and isolation. And also when we did the quantitative analysis, we found some trends and some statistically significant differences in experiences by different groups. For example, socioeconomic groups, with anxiety being higher amongst those on lower income, as you would expect, and also amongst young parents, and other inequalities, also through the ethnicity lens, inequalities coming through. So in a nutshell, what Babies in Lockdown found was that it's affected everybody in different ways. There was a subset that found the bubble of not having all the visitors and the aunties and the uncles, supported the bonding, supported the bubble that was a healthy, happy bubble, people that weren't struggling to get food on the table or keep the house warm or whatever, but that it also significantly exacerbated underlying inequalities. So those of you who are on social media, I would encourage you to look at the hashtag Babies in Lockdown, follow it, retweet and get involved. We are working together with Home Start and with Parent Infant Foundation, with anyone else, to really use this to leverage more funding to support the first 1,001 days. So that's my summary of insights. I mean, it could have been a talk in itself. I'm now going to pivot to what we as a charity have done to respond to the really significant need that the pandemic has created. As collaboration is one of our guiding principles, the first thing that we did was connect with many different charities, and I think it's now over 100 on this list, and created a single portal, which that's the link to, I don't know if you can see the bit.ly link, where you as professional supporting parents or directly parents can go and find the details of a huge amount of remote support that is offered by very many different pregnancy and early years charities. That information was created in collaboration with those many charities, and the information was also cascaded, because I'm on the National Maternity Review, so it was cascaded through NHS England and out, and also Public Health England and out. So it's just a useful resource. Whether you're talking about someone that's experienced a bereavement, it will give you the details of all the bereavement support charities, or breastfeeding, or perinatal mental health. It's one place where you can access lots of support. So one of the other things that we did pretty sharpish after the pandemic hit was work collaboratively with a few key people, including a wonderful Chief Midwifery Officer, to create new films to go into Baby Buddy, that take existing films and tweak them to really explain that the NHS is open for business, maternity is open for business, but with a COVID angle, but with the underlying messages still intact. And those films are within Baby Buddy, but they're also available for free. Everything is for free, of course, as a charity. That's our commitment, free and advert free, but they're available on our Vimeo. Sorry, forgive me, that should say youtube.com/Best Beginnings. If anyone's typing that in, don't go to Vimeo. Our YouTube channel is much better, youtube.com/Best Beginnings. So those are, I guess, still within what we'd been doing before, because you had the Baby Buddy app and we were promoting Baby Buddy. People were using Baby Buddy during the pandemic. We were adding new films. We were highlighting the work, signposting to many other charities. But I guess the big step change has been this program of work called See, Hear, Respond, which is still going on till March. So I heartily recommend you noting down this link. Basically, we have at Best Beginnings secured funding from Bernardo's, who themselves have secured funding from the Department for Education. And through that funding, we are offering remote support in two ways. We are offering group support. So there's a group support sessions. In any group, there might be between 6 and 8, sometimes 9, but mostly it's 6 or 7 parents. We have women-only groups, men-only groups, and mixed groups. So we have groups for couples, for same-sex couples, or just for mums. Basically, you can sign up for what you want, and anyone that you are supporting that you feel is struggling, that you feel is socially isolated, the beauty about those group work sessions is you connect with other parents, and they end up setting up their own WhatsApp groups. And then also via the same link, which is a sign-up link, you can sign up for more intense one-on-one therapeutic support from therapeutic practitioners. And then if any of you are super keen, we would be delighted if you take down the social media toolkit. For any of those of you out there big on social media, it gives you words that you could post, whether you're doing it on LinkedIn or Facebook. We really want to push the word out about this free support in January, so that more parents can benefit from it in February, because the funding may well run out for it in March. So please do spread the word on See, Hear, Respond. So moving on from COVID to Baby Buddy 2.0. We are talking about a serious step change. We had been planning this step change for many years, but funding as a charity is always our rate limiting factor. The key differences are that the new version will have a daily content pathway for fathers and other non-birthing parents, as well as for mothers. There's an ability to sync accounts between a couple, or it could be a mum and her big sister, more opportunity for you to connect with the parents you support through the app, and I think of particular interest to you, I think, will be the personalised pregnancy care plan and the ability for parents to give feedback on maternity services for particular areas. So I'm going to give you, this is like the timeline just to flash up to say, even though it's not going into beta testing until February, we've been working on it for over a year with huge numbers of mums and dads and frontline professionals giving us their insights, their reflections. We've had expert panels, our editorial board, so that all the content will, as always, be signed off by, for example, the Royal College of Midwives and RCOG. And what beta testing is, not everyone knows, because why would you if you hadn't had to be involved in a development of a kind of something technical like this? It's basically, if you want to get your hands on it early, have a play, experience it, get a flavour of what's working well, let us know if there are any glitches, give us suggestions, because what we'll launch in March, April will be a completely new app, and it will also develop over the months and years ahead, and it will ultimately take content to the 5th birthday. But for the time being, it's going to get us to the 1st birthday. So this is the link if you want to be a beta tester. And it's basically, the beta testing won't start till the end of Feb, but we encourage you to fill in the form now, just while you remember the link. There's a little form so we know who's doing the testing, and then you're basically explicitly joining, if you're not already, kind of the Best Beginnings family and helping us ensure that Baby Buddy 2.0 is as good as it can be. And I'll give you the miniest tour of it. This is proper sneak preview. This is, I think, the first time this has been shown at a public event. We still have the avatar because parents love the avatar, but it's smaller on the screen. The difference is there are male avatars, female avatars, more avatars, and you can personalize any of them. So the route when you onboard yourself onto the app as a parent, you can, depending on what you tell the app, you get different content. And that was always the case, but now it's even more granular, different content pathways. So the bespoke daily information has, in addition to the daily information, there's more kind of push notifications in terms of healthy behaviors, looking after yourself, self-care, and all of this is going to be free and freely available across the UK. And then there's the opportunity, if a local authority or a CCG or an LMS wants to do something a bit particular, we can make extra content for them. And the level of personalization is much greater this time. And one of the key things that we're so proud of, we've been working on with NHS Exon and also with Barts Health Trust, is taking their pregnancy care plans, and there's the 4 of them. I'm just going to lean in and say them right: the health and well-being in pregnancy plan, the personalized birth preferences plan, the after your baby is born document, and then also birth reflections. And that will be in Baby Buddy, so the parents you are supporting can use this in appointments and between appointments and share it with you. And as someone that was involved in the development of the maternity, the Better Births, we're just so proud that we're going to be able to offer this in a few weeks now to the whole country. And another addition for you is the ability for you to share a space with a parent and recommend particular films or content that you feel will support them on their journey. There's lots to discover, and if you beta test, you'll get to discover more of it. I guess one of the key things that you'll all be interested in, choice and making the right choice around your place of birth and ensuring that's informed is going to be really important to the families you support. Although many of them will already have chosen by the time you are seeing them, I thought you might like to know that within the app there is going to be details about every maternity unit, and we're working in collaboration with Birth Choice UK to ensure all that information is in the app in the spring. And then I guess the key addition to the new app is you can be pregnant and have a toddler or a 2 or a 3 or a 4-year-old at the same time. So it will allow you to do that, and it will also allow you to link your account as a parent. Your child's record will flow. So those of you that have heard of the Red Book, as we have called it, this is going to be a formal NHSX accredited, approved digital personal digital child health record. And in time, when the NHS is ready, NHSX and NHS Digital, it will also be a maternity app as well, where the maternity records will flow into the app. So that is the end of the Baby Buddy little sneak preview, but I just thought I would revisit the slide with the link, because I'd love it if some of you become beta testers. And then also as part of that journey, we can tell you more about the fact that we'll also be collecting feedback from the app and can do that bespoke for an LMS. But yeah, beta testing over. So as I'm ending, I've got officially, I think 2 or 3 more minutes. I wanted to just to let you know about 2 lovely uplifting things that have happened during the pandemic. The first is for any of you with preschool children, or any of you who are supporting parents who, as well as going through the maternity journey, have preschool children. It is a puppet show video which features Dr. Ranj of CBeebies fame, and he explains all about hand washing, social distancing, coming home from nursery, and also he does a COVID test on his giant life-size puppet friend. So I encourage you to, I'd love you to spread the word on that. I want more people to benefit from it. And then the final link, which I'm not sure, I'll take it off presentation and we can decide together with Jenny. I can show at the very end of the talk, but it's a beautiful song, this carol of hope, which the Midwifery Ambassadors choir have created, and I have it, and I could play it if there is time. But first, let me stop share and we can decide between Jenny and I whether instead we send you away to do it afterwards. That's me.
Brilliant, Alison. Brilliant, brilliant. Wonderful whistle-stop tour and some amazing information and fantastic work that you are obviously doing. Thank you as well for all the links that have been added to the chat. If you haven't seen the chat box, there's all the links of all the things that Alison have been talking about there, and you can participate there as well. I'll just have a quick look to see if there is any questions. There's just one question here. Jodie Pierce, are you happy for the testing link to be shared with people we believe will want to take part?
Yes, so what that link takes you to is a form, and that form allows you to tell us a bit about you. So we make sure we get a good mixture, multidisciplinary professionals, parents from diverse backgrounds. We want mums, we want dads, we want parents from same-sex couples. Absolutely. The only caveat is we're not going to start the testing until the end of Feb. So as long as people they don't want anyone to be disappointed if there's a communication lag. So share it with pleasure, but it's going to be, we've still got a lot to do. We're still in what's called alpha testing. Yeah, with pleasure, share the link so more people can sign up. When we launch Baby Buddy, I don't know how many of you I can now look at the chat. I couldn't before when I was talking. I don't know how many of you on this webinar were involved, but before we launched the first version back in 2014, there were over 500 professionals who were involved, and you helped us shape it ready for launch. So yeah, absolutely. We feel it's the more the merrier, but it will be late Feb before the time will be right.
Thank you. Is question, yeah, that statement there from Nelson. This is fantastic. I'm keen to bring the idea of being a test to our LMS. Thank you. I'm sure that's going to be wonderful. Rebecca, thank you, Alison. As a student midwife, it's really helpful seeing resources that we can explore ourselves, but also that we can share with new parents. Emily Fowler, I'd love to take a look at the app. However, I don't have children, nor am I pregnant. So would it be a waste to join the beta testing?
I would say it definitely wouldn't be a waste. If you're here at this conference, then you're interested in supporting pregnant women or new parents. That could be because you're a midwife. It could be because you're considering midwifery. It could be that you're a doula, or whatever it is, whatever brought you to this conference, it would be really useful to have your insights. So yeah, it's you know, they say it takes a village to raise a child, and I think that's the case now more than ever. So yeah, please do become a tester. And you could almost imagine it, if you're a healthcare professional testing it, or someone that interacts face to face, how could this help you in your role? It's beginning to think, what extra functionality should Best Beginnings be prioritizing to launch, let's say, the end of this year when they get more funding, that will support your relationship with the parents you support?
Fantastic, thank you. Well, there's certainly been a vote online there just to say play the song. I've heard it, it's fabulous. So
okay.
I think it'd be wonderful to round this off.
Lovely. Oh, I'm so thrilled. And we do have to say a special thank you to the Midwifery Ambassadors Choir,
Absolutely.
to Claire Matthews, and to Jacqueline Dunkley-Bent, and also to Simon Austin, who edited this whole song together. So I shall go to...
While you're doing that, just to say, if anybody does want to leave now, there is a break now, and also the opportunity to meet the expert, the NMC. If you want to go and connect in there, please do. And then Jackie Dunkley-Bent, who's our Chief Midwifery Officer for England, will be talking at 4 to round off the conference. So please join in. So
lovely. So this is the link. I think it's on the chat. It's appeal.com/Carol of Hope. What we want you to do is share this link widely. We want more people to enjoy the song. We might get a few donations, but it's more about lifting the spirits and of the nation and celebrating midwives everywhere. Here goes. You hear it?
In mother's arms or even pups, that's where you find us, somewhere over the rainbow. Bluebirds fly, and the dreams that you dare to, why can't I? Someday we'll wish upon a star and wake up when this time is far behind us. Where mother's birth and baby's born, and life will be a time to share for all. Only somewhere over the rainbow, way up high, there
There we go. Isn't it wonderful? And we must thank the parents who featured in Baby Buddy, and the awesome Carol Thompson of the Queen of Lovers Rock, who just was a friend of Jacqueline.
Thank you so much, Alison. I've stopped crying now. I had to turn my mute off because I was getting emotional. It's a fabulous song, fabulous video, and there are lots of colleagues there. Perhaps some of you will recognise as well, which is wonderful to see. But very grateful for all the work that you're doing. I can't say that enough, and it's just wonderful to hear what the steps are going forward. And I do hope some people who've been part of this and perhaps are watching at another time will join in to support you in developing the next stage of the Baby Buddy. So thank you so much. I want to thank
all. I just seen one of the midwifery ambassadors speaking. All midwives are wonderful, and I think the Midwifery Ambassadors Programme just shines a light on the great work that you all do. So thank you.
Absolutely, yeah. And everybody can sing, actually, so go for it. So thank you to everyone. Please get a bit of a break before we hear Jacqueline, or to join in to meet the expert with the NMC. Thank you, Alison, for stepping in at the last minute as well.
No worries. Sorry about my confusion. It was the doorbell was going. It was all happening on the home front. Blimey. The joys of a working mum. What can I say?
Exactly right. Thank you to everybody. Okay, thank you.
Yes.